80% of the food is not healthy food, and most of it is ultra-processed food, disturbing our appetite regulation system and ultimately also affect our stress systems and contributes to obesity.
Welcome to the Stress Navigation Podcast. In this podcast, we'll talk about stress, science, and daily life. We'll interview experts in the fields of psychology, psychiatry, physiology, genetics, sociology, data analysis, and much more. Hello. Today we are talking to Liesbeth van Rossum, an endocrinologist and professor at the Erasmus Medical Center here in Rotterdam. This is where we are, in the office. It's nice and bright today. She specializes in obesity and biological stress and is amongst the top 100 people who have had the greatest and most innovative impact in Dutch healthcare. She's the co-founder of the Obesity Center here at the Erasmus Medical Center and the co-author of an international bestseller called Fat, the Secret Organ, which we'll talk a little bit about today. Thanks for coming on the show, Liesbeth. How's it going?
Well, it's a great day, and thank you so much for coming here to Rotterdam.
Yeah, it's a pleasure. It's nice to do a little tour around and interview people. We started in Amsterdam, now we come here. But yeah, let's just dive right into it. We at the Stress Navigation Podcast talk about stress and how it affects us at many levels. And of course, there's many ways to explain stress. They're all somehow connected. We've talked about psychological experience of stress in other episodes. We'll also talk about the behavioral effects of stress. But given your expertise, I want to know more about the biological side of stress. So what is exactly biological stress?
Well, that's a very good point, because I think stress has so many dimensions. And actually, when we talk about biological stress, it's more like the stress reaction of the body and the bodily functions to perceive stress. So maybe it's also good to disentangle the types of stress, because we have like acute stress and chronic stress, but we also have mental stress and physical stress. So let me give you some examples. For example, if you are waiting for a train and you really need to go to an important appointment to be in time, but at the moment you discover the train is late, you can get mental stress, acute mental stress. And the body will react to that. But it can be also that maybe the train is still there and it's about to leave and you have to run for it. And then the body also creates physical stress, which is very beneficial, because you may catch the train because your body reacts to the stress. Mm-hmm. So acute stress can be actually be sometimes very helpful in an exam, or when you have to run their 100 meters finals. And what happens in your body is that there are several stress hormones. One is related to your central nervous system. For adrenaline is getting produced, but also in acute stress, one of the stress hormones, cortisol, is being produced. And these stress hormones, they increase your blood pressure. They let your heartbeat go faster. And actually, it's very beneficial, because at the same time, also glucose is being released in your body and energy is being brought to, for example, to the brain. You can think faster and better. And glucose is being transported to your muscles, for example. You can run faster. So this acute stress, it can be very beneficial. But sometimes it gets into chronic stress. And that can be, for some, if it takes very long, can be detrimental, because in chronic stress, predominantly also your cortisol will be high. It's produced by your adrenals. And when that's high for a long time, it can have all kinds of negative effects on your mood, can cause depression or anxiety, but also on your body. For example, it's not good for your muscles. You can increase your body fat. It can increase your risk on type 2 diabetes and many other effects. And so biological stress is a reaction to mental stress, but can also be to physical stress. For example, pain. If you are chronically in pain or acute pain, also the body can react. Or shortage of sleep. Also, you can have a physical stress reaction. So Actually, the stress systems are very universal, can respond to mental or physical stress.
Mm-hmm. And it's a full body experience, right? Because you already mentioned hormones coming out from the brain, from the central nervous system. Then there's a connection to the adrenals, which I believe are in the kidneys, right? On top of the kidneys, is that right?
Yes, exactly. I think it all starts in a sort of very central region in the brain, very important, the hypothalamus. And actually, in the hypothalamus, many processes are being regulated. So our appetite, our temperature, our sleep, but also a lot of hormones are being regulated there. And only one of the hormonal systems is the stress system, and it all begins there with a specific hormone being produced there, which stimulates another important gland in just underneath the brain, the pituitary, and there other hormones are being produced who go to the adrenals, and they're indeed right. They're very mini organs right above the kidneys, the renals or adrenals. And they're very, very tiny, but they are so important. Actually, without adrenal glands, we cannot survive. There is no person living without adrenal, or you have medication for it. Some people have the disease, and that's people I treat actually in my clinic, in the academic hospital. But you need then to take the stress hormone cortisone for it. So it's a very important system for survival, not only for stress,
Essential.
but for survival.
Essential. You mentioned appetite, you mentioned sleep, just responding to everything that's happening day to day. It's just stress is necessary to either push us towards what we need or to help us avoid what we don't need. But then I had a question here in the difference between what is acute and chronic. When is it considered chronic? When is something when I've been exposed too long to stress?
Well, that's a good point. But when it's very individually determined when it's really too long. I mean, there's even some persons who go well by some level of stress. Some are being stimulated by some stress. But we know, if you have it for a few minutes or for a few hours or even a few days, it happens to all of us. That's normal, and it's normal in everyday life. But it's important that the stress system returns back to normal levels. And in some people, also after a stressful life event, for example, it keeps on turning to be high. And in some also, the whole feedback mechanism is being disturbed, because it's important to realize there's a beautiful system in our body that when the adrenals, they produce cortisol, that regulates all these systems in our body, like we described, the glucose, the muscle mass, the fat mass, but also it regulates its own production. If there's a really high levels of cortisol, normally it gives a signal to the brain at the hypothalamus level, but also at the level of this pituitary gland, and it gives their signal to inhibit its own production. So all these stimulating hormones, they go down, and normally you go back to a resting state with normal levels of cortisol. But somehow in some people, they have less of this beautiful negative protective feedback system, and they keep on turning very high cortisol levels. Can be due to alterations in this stress system that's individually determined, but can also be that the stressor is still there. That, for example, your boss at work is still yelling at you every day. So there's huge stress that can overrule the system, but can also be that the feedback mechanism is disturbed.
Well, this makes me think of a definition that we got from a person on the streets that we wanted to play to you and also discuss just a person, I found and recorded. Because this reminds me of it. So here is this person. So what do you think stress is, and how do you experience it in your body?
Okay, I think stress comes from the inability to feel like you're in control of a situation, and the response in your body, the stress response, comes in forms of heat in your chest, and maybe anxiety, and maybe headaches.
So it made me think this definition, especially the beginning, the lack of control, like maybe how that can relate to chronicity.
Yeah.
So if the experience makes you stressed, and at some point you would recover when things get back under your control, or at least perceived control, right? But if your boss keeps yelling at you, that's out of your control. Or
exactly. Yeah. And that's also an interesting phenomenon that you can get used to several types of stress. We know that if you do, so this is very interesting, this stress reaction, if something is new, for example, you indeed feel out of control and you can have a huge stress reaction. For example, your first time of doing parachute jump. I actually did it once, was pretty stressful, I can say. But if you do it for several times and you know what to expect, you can get in control, you know you can handle it. I must say, I did it only once, so for me the next time will be stressful as well. But we know also if you do artificial stress, we have this mental stress test, what we can do in laboratories, like this trigger social stress test. And we know if you do it repeatedly in persons, put them under really severe mental stress with some calculation task and a comedy who's very mean to you, or so that's a very mental stress test. But if you do the same stress test several times, you see also that the bodily stress reaction is there. There's still a peak, but the peak is much higher and more rapidly down than the first time. And that also is one of the things, is in that indeed knowing what to expect, getting in control. And that's a very important factor of how you perceive the stress. So how you perceive it is also related to the bodily reaction.
Yeah, I find that mind-body connection fascinating, how your perceived control of things and helps your body regulate itself. And yeah, that's basically what it is, just a constant interconnection of parts in the body. And then I was also curious, in this whole complex system, how do you measure stress in a way that is simple, or that gives you the most amount of information necessary to do your research or to treat your patients? How are you doing that in the lab?
Well, that's a huge question, as you know, because we were working with this huge consortium to disentangle how to measure stress, and there's no simple answer. But there are some tests already which can test some aspects of stress. Of course, you can measure stress also with questionnaires. How mentally stressed are you? How is your perceived stress? You can measure stress also related to your heart rate variability, for example, which is more some types of physical stress. But you can also look at the stress hormone cortisol. It's a bit difficult to really relate it to stress in the classical tests, because a classical way is, for example, to measure it in blood. But cortisol has a very diurnal curve, so it's very high in the morning and it's getting down, it's decreasing over the day, and at night should be really low. And there, in this diurnal curve, you have also this pulsatility. So it doesn't matter if you draw blood at 8 o'clock or at 8:30. There depends in the pulsatility which measure you get. So this is difficult. And it's a stress hormone. So if you draw blood, for some people it's stressful already. Yeah. So then you measure how stressed is a person to draw blood. And that's not necessarily how stressed you are in the day. So now there are new measures. One interesting measure is to measure your stress hormone cortisol and cortisone. It's also a precursor of the stress hormone cortisol in scalp hair. And that's not a acute measurement, but it's more reflecting the mean stress hormone levels of the past weeks or even the months, because this stress hormone cortisol is incorporated in your hair, and hair... Yeah.
Why would the hair need it?
Yeah.
Yeah.
Well, you can actually measure a lot in your hair, even toxins or anything, or drugs. It's actually...
Why does the hair keep it?
Maybe it helps because it helps the forensic researchers. If someone gets drugged, they're what was coming from. And they also detected, cortisol can be measured, steroid hormones in general, and hair is growing about 1 centimeter a month. So that means that every centimeter is about sort of a calendar of your average stress hormone levels in that specific month. So if you measure 3 centimeters, you can look back in retrospect for the past 3 months. How was your stress level? So that's more like an average level. It doesn't necessarily show who exactly stress reactive are you. So if you...
It's not a day-to-day measure, of course.
Yes, it's more average, but it's very helpful because we know, and we did a lot of research on it, that it really is strongly related to, for example, the amount of body fat you have, and other health measures. So it's an important measure to know how stressed is the body in general in the past weeks to months.
Yeah, and actually really easy measure. You don't have to, it's not invasive. It's just, how much hair do you need to take to do that?
Yeah, it's just like the thickness of about a pencil, so about 100 hairs. And you don't cut it out, would be a major stress moment, I think. You just cut it very close to the scalp. So indeed, for participants or patients, it's very easy to take, and it's not dependent on the time of the day, for example. Because for many stress measures, like in saliva or in blood or in urine, it's very dependent what time, what day. So it's a very easy measure indeed.
So this feels like top of the line ways of measuring stress at the moment. But I'm curious, like if you had unlimited budget and what device would you envision? Is there a step further than hair cortisol, or something that you dream of that we could do to measure stress?
Well, definitely. I think there are many other measures, and we are actually also currently studying how to translate to simple measures. But one very interesting measure is, for example, that you can measure cortisol at a tissue level. So in the cells of the body, you can actually measure it. We are also going to do it with some test persons soon, and relate it to all kinds of variables, also perceived stress, measures of the heart rate variability, but also saliva and urine and all kinds of other hormones and testing. What exactly is the best reflector of daily life stress? So we are going to study a lot at the same time, and we try to disentangle what will be the best stress measure and easy to measure, because you can imagine it's really hard to let persons, if you study big populations for their stress levels, you cannot study all the time their cellular cortisol levels, so the cortisol within the cells, because you have to wear a needle in your
like
your
a
cells,
little belt almost,
and a belt
yeah.
in the belly region. It's awkward. It's
Yeah,
not feasible. So we need to translate to simple measures, and we think maybe in the future we can measure, for example, with a simple variable, the continuous cortisol levels
like
in
a
the
patch,
blood.
like a glucose patch, or
Exactly.
cortisol, yeah.
That's what some research are currently developing, measures how to measure continuous cortisol levels in blood, like indeed glucose sensor.
Yeah, this is important to remember, that it's so hard to measure all the complex things that are happening in the body, and we're trying to find the most reliable measures that give the most amount of information, but also that it's most feasible and that it doesn't bother the people who are being measured. And that's a big challenge for sure.
Yeah, so some of these measures already do exist, but they have not well be validated, and how good you measure the mental and physical stress with it. So that's what we're about to do right now, and to combine a lot of scientific tests which already exist. And, test the best, actually.
Yeah, well, that's exciting. So let's see what happens. Let's see how it develops. And just out of curiosity, what's the smallest little thing in daily life that stresses you out? Just as an example, for me, something that stresses me out, you know, when you're showing someone something on your phone, and you're, I have a picture for this or a video, and you start looking, and then you see that you're not finding it, and then you know that the other person's attention is starting to fade away, and you're like, I can't find it. That little moment stresses me out, for instance. Do you have like an equivalent little slice of life stress that you experience in daily life?
Well, for me, I do athletics, and I can be sometimes really stressed for a competition, which I think is good and it's normal and it's actually beneficial. I do the short sprint and long jump. For example, last week we had a really important match for the team, the Dutch championships, and the final event is then the relay, and I had to start, and I had to hand over the relay baton, And that is such a major stressor because you are sort of responsible for the team. It's because we know if you drop the stick, you have 0 points and the whole match is over. I mean, then
high stakes.
That's horrible because the pressure of the team, because you really can destroy it if you do it wrong. And actually, to be honest, a couple of years it went wrong in this relay. So since then, I feel that the stress levels can be really high. On the other hand, I think it's beneficial because it actually it worked out. We run pretty fast, and then the stress is maybe beneficial to be stressed about not dropping the relay baton, and because you just run faster. So maybe be helpful anyway.
That context is super important for how stress manifests itself, right? Sometimes it can be great for focus, sometimes it can distract you. But yeah, I find it funny. Definitely higher stakes in your stress example than mine of just showing someone a picture on the phone. It's just like, oh, am I going to find the picture on time? But
but actually on the phone, you have also that type of... What I think is for these social media, sometimes you have this, when you scroll in Instagram, you can get in a picture where you get in a screen that you can, I think you can record or anything.
Oh, accidentally start recording live.
And I watch these socials or also the news at any time in day. It can be also right after a shower or something. And that also stresses me out that you are so in the wrong time, in the wrong place, that you
might press
filming
the wrong
yourself
button.
live. So I think like everyone, I can experience stress like that as well. And maybe it's not so helpful.
Oh, that's good. But then I also want to move on to the next topic, which, well, you're specialized in obesity as well. And you wrote this book called Fat, the Secret Organ, under the pretext that it is a misunderstood part of the body, fat. So why is that the case?
Yeah, I wrote this book actually together with Mariette Boom because we know there's so much science known about fat mass and obesity. And people think just too simple about it. They think, well, it's just a matter of some energy surplus and or a layer of cells for isolation, and just eat less, move more, problem solved, and it's all your own fault. But we know that fat mass is an organ. It's producing hundreds of hormones and also substances which are really important for the immune system. It's a very active hormone. And we know if you have too much, it gets slightly inflamed, and this inflammation, but also all these fat hormones are getting disturbed, and that disturbs so many things in the body. It can dysregulate your appetite, it can dysregulate your mood, so it can actually make you more stressed because it can lead to depression and anxiety. But of course, also many other diseases can be the results, like we all know, and like 200 other chronic diseases, and not only type 2 diabetes, of cardiac infarction, but also 13 types of cancer, joint complaints. So many other diseases can be the result. And we know that also one of the interesting things related to the topic of stress, we know also in the fat cells, it can activate your stress hormone, because there's an enzyme present in your fat mass within the fat cell, which can activate the inactive hormone cortisol and can activate it to the active stress hormone cortisol.
So without going through the hypothalamus, adrenal pathway, it does its own thing to activate the stress system.
Right, and that's actually quite horrible, because we know that from the stress hormone cortisol, you can develop obesity, and cortisol can be high due to several reasons, as we discussed. Can be stress, but can also be an abnormality within your adrenal. It's pretty rare. I do see those patients, though. It's called syndrome of Cushing's, and can be at a layer also at the pituitary, that there are too many stimulating hormones produced, leading too much cortisol. That's called Cushing's disease. That's rare, but it leads to more belly fat. And we have some more and more indications that also due to maybe stress or cortisol in the general population, we have a lot of association studies showing that the higher your cortisol is, that also in the years after you have this high cortisol, that you're more prone to develop more body fat. And now knowing that the belly fat can also activate your stress hormone, you can realize that you can get into a vicious circle. Maybe you had a lot of mental stress, then you develop more body fat, and in the body fat, more cortisol can be produced, which can also make you more stressed or can affect your mood, can also lead to all kinds of other diseases in the body. And so it's important to be aware that, I mean, you mentioned also your head and the body, that it's not a coincidence that your head is attached to your body. They communicate so much. It's not like people often see the brain as a separate organ. Well, it's so connected to your fat mass and so connected to all kinds of other systems. And I think that's a tricky one, that once you developed obesity due to any reason, and there are many reasons, that can get you in a vicious circle, or creating more appetite, for example, and making your body more stressed.
Mm-hmm. Just out of curiosity, I'm also very interested in the gut microbiome. Do we know a lot about the connection between fat as an organ and the microbiome, and also the brain and the stress systems?
Yeah, I think in current society, there's a lot to do about microbiome, because we are perfectly well in disturbing your natural microbiome by, for example, eating a lot of ultra-processed food. Mm-hmm. We know that get alterations in your microbiome, which can also contribute to obesity. It also alters, for example, your intestinal hormones, which regulate your appetite, because we have in our system a lot of not only fat hormones, but also intestinal hormones. Like a well-known hormone is GLP-1. That's a well-known hormone because it's also in a lot of medication for obesity present, which is worldwide hype right now. And normally, if you start eating, then after about 20 minutes, then a lot of satiety hormones, which just make you feel full, they start to be produced, and they give a signal to the brain, I'm feeling full, now I stop eating. But in obesity, the effect of these hormones is different. There are also many hormones in different levels, and this whole protective system is being disturbed. And so once you develop obesity, you're more prone to develop further obesity. And interestingly, we know that also the stress hormone cortisol is also related to appetite. So we know from very high levels of cortisol, it increases your belly fat. So that's the bad fat, so what we call, because it influences also other organs, like your liver gets fatty and your heart. But at the same time, it's also leading to increased appetite, and specifically appetite in high caloric food. So maybe you will recognize when you're stressed that you're much more prone to take a bar of chocolate than eating a healthy salad, although you know the salad is much healthier, but your body...
It won't make me feel as good, no.
Yeah. And your body needs, or thinks it needs, acute, rich calorie food.
Yeah, as if you were going to like fight someone or escape something, right?
Exactly.
You need energy immediately.
Yeah, you can imagine from evolution, it will be very normal. It's very efficient if you're being hunted by a tiger. If you first have to eat your salad, well, no, better take a quick bar, immediately glucose, fatty, you can use your energy. So from evolution, it's very
makes
good.
Sense,
makes sense. But now in the supermarket for example, the Netherlands, and I know in other countries it's sometimes even worse or the same, 80% of the food is not healthy food, and most of it is ultra-processed food, disturbing our appetite regulation system, and ultimately also affect our stress systems and contributes to obesity.
Well, this is a lot, because you've mentioned some very rare aspects that can cause obesity, some problems with the hypothalamus, for instance, but then we're talking about very common things, day-to-day life, so our access to healthy food. I guess in that sense, that might connect as well to socioeconomic status. If you have less, then you're likely to buy more cheaper, ultra-processed foods. So what are all these categories, if you could enumerate them, that contribute to fat, from common to the most rare, for instance?
Oh, that's a very broad question. And actually, we wrote in our new Dutch national guideline that there are like 7 categories at the individual level. And of course, you also have the society level. I think the society level you just mentioned, it's of course the unhealthy food environment. We exercise too little, but also we have in our environment endocrine disrupting chemicals, what we call. These are small like hormones which disturb our natural hormones, and they are in plastics, they are in cosmetics. They all at the societal level, we need more rules to, and I think the governments worldwide should do much more about that. So that's on a society level. Well, when we look at individual level, we have basically 7 categories. One is of course lifestyle, eating too unhealthy, exercise too little sleep, meal timing, eating too late, use of alcohol. Then you have the socioeconomic factors, in the poverty, and people who feel lonely. We have psychological factors. Some, for example, depression. Depression can lead to obesity, but it's bi-directional, so obesity can also lead to depression, but also, for example, trauma, childhood trauma, sexual trauma, but also binge eating disorder. So that's category psychological. That's the third category. Fourth is medication-related obesity. So we know many people are using one or more pills, tablets, or other types of medication, which can induce weight gain. Then we have a fifth category of hormones, very common hormones, like a lot of, for example, a lot of women have thyroid disease, so the thyroid is not working properly, and which can lead to weight gain, but also pregnancy-related kilograms, menopause, low testosterone in males, and some more rare hormonal diseases. And then we have more rare categories like hypothalamic damage. So this a very important center in the brain can be damaged, for example, due to an accident or a tumor. And then we have last categories, genetic obesity, and they typically have obesity from a very young age. They have increased appetite, and they often have a striking weight difference with other family members. Then they have often in one obesity gene a mutation which directly can lead to obesity. This more rare, although a few percentage of people with obesity has such a mutation. It's often missed, but it's more rare when we compare it to lifestyle, medication-related, or hormonal obesity.
It's fascinating how multifaceted this is. It's much more than just a simple, well, you're eating too much, you're not exercising enough, and there's so many things that seem out of our control as well. If you're taking medications, and that can also induce weight gain. Things that are in control, like your socioeconomic status as well, and how society is shaped, and the access to foods. So it makes me think also about the stigma that is around obesity and how we talk about it. Usually it's viewed as this lack of self-discipline, people are discriminated against. I've also heard even within the medical community, historically, there's also been stigma against obese patients. And I just wanted to ask you, how do you tackle this topic, considering its sensitivity? How do you talk about obesity without creating more stigma?
Yeah, it's interesting what you're saying, because the stigma is huge, and also in healthcare, even doctors are treating patients with obesity differently, and interestingly, that can induce actually more stress levels. Also, we know that actually people with obesity, they have on average way higher cortisol levels. We don't know, is that causally related, or is it a result of? Probably it's both, because it's very
Usually
bi-directional.
Everything is bi-directional, yeah.
But stigmatizing will definitely not help losing weight and really lower quality of life. What we help in clinic, what we do is first check the underlying causes, and it's actually almost always multifactorial. Yes, it can be unhealthy lifestyle, but in many people there's also medication play a role, or even also stress hormone related medication like corticosteroids is an artificial version of your own stress hormone cortisol. And millions of people already in our country, out of 70 million people, about 6 million people every year is at one time point at least taking one medication containing the stress hormone type of stress hormone, corticosteroids. It can be inhalation medication, can be prednisone tablets, creams, exactly, nasal spray. It sometimes can also, in some people, contribute to further weight gain. So to tackle the stigma, it's important to look at all the underlying causes. In Dutch, we have launched the website check oorzakenovergewicht.nl. It's in English, checkcausesobesity.com. Will be launched very soon, and there you can check with algorithms based on international guidelines what causes can play a role in your obesity. And with this result, you can go to your doctor, and then the whole discussion about this, it's way different. And if you say, okay, you have obesity, go on a diet and good luck, which we know it's not effective. Yeah. So step one in our office is we first ask permission to discuss the topic. So you're coming here for your blood pressure or your knee complaints. Is it okay to also talk about your weight? And we know from research that the far majority thinks it's very helpful, and they like actually the thought to talk about it. And the few who don't want to, you wait till a later moment, or that's okay. But don't stigmatize, don't do judgmental, do non-judgmental, and look at the causes, and then do personalized medicine, what a person needs. And it can be social help, it can be reduction of your medication, it can be lifestyle intervention. And we know all these things, which are most of them also related to the stress systems. It can, if you have proper obesity treatment, whether it's a lifestyle intervention, better sleep, exercise, or additional treatments, it can also lower your stress hormone cortisol.
Yeah, well, after hearing you, it makes me feel that tackling it as a complex issue that can have many causes can just help reduce the stigma, because it's not the responsibility only on me. There's just so many things happening. Yes. Of course, we have to evaluate them all and take it step by step, but it kind of reduces the weight on the person maybe who thinks, oh, maybe it's all my fault, right? No, it's just all these things happening. And it's good to hear that, you know, there are ways in the medical community as well as tackling it in a non-judgmental way and also personalizing the interventions, which leads me to my next question about lifestyle interventions or strategies to tackle this. I bet it's different for everyone. So could you give me an example of a way to implement a lifestyle prevention, or a case of someone that you thought, wow, this was really a successful example?
Yeah, what's really important to look at a person also, what a person needs. And if you're talking also about stress, how to reduce the stress levels, and especially in the combination with obesity, the basis is in healthy lifestyle indeed. And it's healthy food and especially guidance with it, because in these times of unhealthy supermarkets, people need also some guidance how to do what's the healthy food, how to recognize it. Do a lot of exercise, and it's not necessary that everybody do elite athlete sports, but walking every day, taking the stairs, doing strength exercises. Even while you're, for example, toothbrushing, you can do some squats, or you can strengthen your muscle in a simple way and implement it in daily life. And we know that if you have a more better body composition, it can reduce your stress levels. For some people, also mental interventions can help, like yoga or mindfulness or other mental, or if there's really high stress levels or trauma, of course you need more like psychological help. One very basic advice is also good sleep. Have good sleep, but it's also good for your stress vulnerability to be resilient. And also social context is important. People who are lonely, they can have higher stress levels. But when you have a good evening laughing with your friends, it's so relaxing and can also de-stress a lot. So it indeed depends on the individual, what the individual needs with respect to stress. And when you look to the obesity interventions, well, you have to look at the causes. I think one good example was maybe one case I had last year. She was a woman. And actually, she was referred to me from another specialist in the hospital because he had to do surgery on her. And she was actually in a wheelchair because she was immobile, and she needed a hip surgery. And he asked me, does she have Cushing's disease? Because she had some signs of it. Therefore, he referred to an endocrinologist, and I checked her, I did a test. But, well, she had abdominal obesity and some signs, but she didn't have this Cushing's disease. I tested that but she had 11 types of medication, and almost 6 of them had a potential weight-gating side effect. She turned out also out to have a type 2 diabetes when she was at my place, at my office. And so I referred her to a lifestyle intervention, targeted also to type 2 diabetes. But before I did that, I tapered down almost all medication, very in a controlled way. So I do not recommend now to stop all your medication right now. Always talk to your doctor and discuss, because also in these algorithms in check cost obesity, you can find out which medication can be have a weight gaining side effect, and taper down with the physician who prescribed it. And then sort of I facilitate the weight loss, and then she did her lifestyle program, and within a half a year she lost 22 kilograms, and she had only 2 pills at that time, and her glucose levels were well controlled. And then she told me, my big dream is to go on a bike again. She could actually walk again, right? It was a major step to get out of her wheelchair. And her big dream was to cycle again, which we all do in the Netherlands, of course. And so actually she went through, and a couple of months ago I saw her again, and she had no medication. Her diabetes was away. She lost in total then 24 kilograms, and she could cycle again. And actually the major point here was to take away her stress hormone containing medication, and that facilitated her weight loss. So mentally and physically she was reborn.
Yeah, wow, that's amazing. And it makes me think, connected to stress and action and the stress assessment toolkit that we want to develop, that perhaps in this journey of lifestyle intervention, all of these wearables could perhaps help, right? With monitoring and gaining access to your own health data to motivate you to keep going. Is that also something that you envision for the stress assessment toolkit that we're trying to develop?
Yes, I think that will be the holy grail, to see at the individual level what makes you stressed. And if you know what makes you stressed, and we can measure that very well, we can target, personalize all the interventions. So yeah, that's our big dream.
Yeah. And well, before we end, I also wanted to talk, we mentioned a little bit before about the relevance of individual but also societal work in the development of healthy lifestyles and just a healthy society. You're also a part of the European Association for the Study of Obesity, which have connection with the World Health Organization and the European Parliament. Would you mind telling us a bit about this role in the EASO?
Yeah, I think at European level, what we need to do is a lot of more prevention, because if you realize how difficult it is once you develop obesity and all these hormonal disturbances and this inflammation is present in the body, so basically your body is very stressed actually, and it's so hard to lose weight. You can lose weight, but we often need more than lifestyle only. You sometimes need also medication or even bariatric surgery to lose weight. And you don't want to get into that. You want to prevent people from developing overweight or obesity, and realizing that also in Europe, more than half of the population has already overweight or obesity. And we know with the current environment, it will be getting worse and worse and worse. And now we are waiting until there's a cardiac infarction or cancer, and then we start treating in the medical world. It's ridiculous. And yes, we should treat, because there will always people with obesity. But at the same time, what we do need is to do more better universal prevention for everyone. Healthy food environment, exercising, reduce stress levels, in the context of what a person needs. So we need huge measures, and partly there will be also need to be in laws, because we know that companies themselves will not turn their supermarkets into holy grail healthy supermarkets. They need rules from that they need to do that. Yeah,
and do you have an example of any policy that has that has gone from the EASO to government?
Yeah, I think it's the EASO collaborates also with, for example, the European Society of Endocrinology and the diabetes organizations and many, and collectively we urge all the policy makers to do more. And what you see different very much per country, that in some countries there's a sugar tax, for example, which can be effective In other countries, there's lower tax on vegetables, or there are rules on marketing, on unhealthy products. But what we do need is actually not one rule or one law per country. You need in every country a package deal of all kinds of rules, then you're much more effective. So we are collaborating a lot worldwide right now, but we are far from being there.
Yeah, well, that's the thing about complex systems, right? It's not just turning one knob. You have to turn many at the same time to deal with the problem.
Absolutely.
Yeah, but this talk was really, really interesting. It's got me thinking about how complex things are, but also it's giving me some tips on how to navigate it, and we hope it's done that as well for the listeners. So yeah, this is what we do with the Stress Navigation Podcast, and if you want to keep on listening, we will have more interesting episodes. Thank you very much, Liesbeth, for being here today.
Thank you so much. It was a great pleasure.